Hello everybody, good morning, and this is a part of my video series called Your Question, My Answer. So Michael asked me this question. I use a CPAP machine and also wear something on my back so I sleep on my side and still wake up with headaches and ringing in my head. My machine says I have zero point 0.1 events per hour. Any suggestion, please? Thank you. So this is about CPAP, um, and I'm gonna discuss this issue, which is quite a common issue. So let's delve into that. So waking up with headaches and tinnitus despite low AHI. What's going on here? Hello everybody. I'm Dr. PK from DrPKLyfe. I'm here to answer your wonderful and questions. Your questions are very interesting, but it's day-to-day questions I face commonly in my clinic, and so I'm happy to answer what I do in this kind of situation. So today we are diving into common issues many people with sleep apnea experience: waking up with headaches and tinnitus despite having a great AHI. AHI is apnea hypopnea index of zero point 0.1 per hour. As long as it is less than 5 per hour, you are good. But in this case, his sleep apnea seems to be quite well controlled. So if that's you, stick around because we are going to explore why this is happening and what you can do about it, right? So if your AHI is low, but you're still waking up with morning headaches and ringing in your ears, it often means something else is at play. And let's walk through what could be causing these issues and what you can do to fix them. So first, let's talk about your CPAP machine. Even with an excellent AHI, some CPAP related issue can still cause discomfort, and the most common ones are mask or mouth leaks. Leaks can cause sleep disruption, dry mouth, pressure swings, and of course morning headaches. So check your CPAP leak rate report, not just AHI. It should be less than 10 liter, okay, ideally. So please check that leak. Number two, pressure or comfort setting. If your pressure is too high, or if it's rising a lot on auto CPAP, you might wake up with pressure headache. Ask your sleep clinic to review your pressure range, and 95% of the pressure and the flow limitation, and something called RERA, which is respiratory effort related arousal. So those the numbers would help guide the pressure in your machine. Number three, the oxygen dip. Some people experience oxygen desaturation or hypoventilation that are not reflected in your AHI. You might want to get an overnight pulse oximetry test to see if your oxygen levels are stable during sleep. Number four, humidity and sinus congestion. Nasal congestion or dryness can also trigger those morning headache. Try adjusting your humidifier level using heated tubing, doing a saline rinse or checking for any allergies or sinus issues. Okay, so now let's talk about some non CPAP issue of your headache and tinnitus. Number one, teeth grinding, bruxism or TMJ issue, a classic cause of morning headache. Migraine or tension headache can also lead to morning discomfort. High blood pressure in the morning spike is another possible culprit. And of course, caffeine, alcohol, dehydration, poor neck positioning can make things worse. As for ringing in your tinnitus is concerned, it could be also because of wax buildup or hearing loss or noise exposure or even certain medication like NSAIDs. So here's a simple plan to get to the bottom of the things. Check your CPAP report, look at your AHI leak report, usage hours, pressure trends to see if something is off. Get your blood pressure checked, especially in the morning readings for 2 weeks. Ask your sleep doctor about overnight oximetry test. to track oxygen levels and if you need a pressure adjustment. If your headache persists, consider evaluating for TMJ or bruxism. Visit a dentist about night guard, or think about seeing an ENT or audiologist for your tinnitus. Now, here's a big red flag. If you experience any of the following, please get checked right away. A new severe headache, especially if it is different from what you usually experience. Neurological symptoms like dizziness or vision changes or weakness or chest pain or severe dizziness, one-sided hearing loss or pulsating sound in your ear. So if you are waking up with a headache or tinnitus, even with a low AHI, don't just ignore it, but follow these steps. You can get to the root cause and start feeling better. If you want, drop me a comment with your CPAP leak rate and any other symptoms you're experiencing, or a screenshot of your CPAP report. I'd be happy to help you. Don't forget to like, share, subscribe, and repost for more helpful, practical health tips, and take care of your health. I'll see you in the next video. I'm Dr. PK from DrPKLyfe.